Dr. Nadine from Bump and Beyond Family Wellness. I have Becca Rose from Wisconsin Myofunctional Therapy joining me here today. We are doing a webinar on posture, the nervous system, and breathing, and how it's all connected. So today we're going to talk about how chiropractic care and myofunctional therapy work together. So to get started, we're going to start talking about posture and the nervous system. So nervous system is primarily what I work on, right? Chiropractors are nervous system specialists. So posture is the foundation of the nervous system. If you think about it as your brain, think about your spine like a phone charger, right? Your brain is the power source. The spinal cord and the nerves are the charging cable. And the muscles, organs, cells, all the other things that the nerves are connected to are the phone. So when you have a misalignment in your spine, the power, right, it's maybe trickling through or it's kind of getting through. It's kind of like a kinked cord. But what happens is the power is not getting through properly or fully, and things stop functioning the way they're supposed to, and you start to develop symptoms. So the power still flows, but not as clearly or as efficiently. And that is where chiropractic comes in, right? So as a chiropractor, I correct the misalignments or the subluxations in the spine. So therefore, I work on the structure. So posture and spinal alignment, right? They are connected. If you think about how does your posture affect the spinal cord and how things function? Well, think about your posture, right? If you're slouching, you're not having good posture, everything is kind of compressed, right? So specific chiropractic adjustments are going to address the spine, but we also need to address the muscles, right? We need to address the muscles that support posture and the spine. And some of those muscles actually start in your mouth.
Oh, what happened? Oh, sorry.
Pause. Oops,
Pause.
Slideshow is disrupt. Oh, there we go.
Technical right from the beginning. I apologize for that.
And off to Becca.
And often to me, that's how I introduce myself, with a technical glitch. Yeah, so Dr. Nadine introduced me already. I'm Becca Rose. I am a myofunctional therapist of Wisconsin Myofunctional Therapy. And yes, everything. So Dr. Nadine thought it would be great to bring us all together today to really put together how we're all put together and how we're all connected, and how posture and oral posture plays a role in overall health. So when we're looking at things from the muscular perspective, I focus mostly in the area of the mouth and the face. So we know, most people don't know this, but there's a really huge connection with overall body posture and how the tongue is postured within the mouth. And then those muscle patterns, they start to affect, like you were talking about, like that forward head posture, and it goes down the line. So we're going to talk a little bit about the oral rest, the diaphragmatic pelvic floor connections, and how we're all connected from the mouth down to our toes. So another part of this is the jaw. So we have oral rest posture with the tongue, but also the jaw itself plays a big role in maintaining function and posture. Diaphragm, pelvic floor, we kind of touched on that. We'll get to those a little bit more. And then we'll both at the end, we'll offer some just simple tips and strategies to things to do at home just to help bring, if not anything, bring awareness to your posture so that you can start to make some good improvements with your health. So this is just a photo of the tongue, and this can be sometimes hard to visualize if you don't have a lot of knowledge with the oral cavity, but what we're looking for is we want this whole tongue to be able to kind of stay up against the roof of the mouth. So this is the roof of the mouth here. The tongue should be able to rest comfortably within that space. And that is part of the pillar that supports our whole head and neck structures. It's connected to everything. If we find positions where, or we find circumstances where people tend to have maybe the front part of their tongue touches the roof of their mouth, but then that back half kind of drapes down like that, that's where we can start to have inefficiencies with breathing, and we start to have a little bit more of that forward head posture, and it travels down the line. I just added this slide this morning. Oh, and now I got these lines on here still. Oh my goodness. So Dr. Nadine was saying earlier that I have a little bit of experience doing some of these things, but I'm not showing it. It's I'm making all the mistakes.
You're much more comfortable than I am at this moment, so that's okay. This is my first webinar, so it's good. We're doing good.
Well, and this is real life. This happens to everybody. You know, yes. You think you have everything prepared, and then there's like technical glitches. So I apologize for that. But I just added this slide this morning because it showed up in my Instagram feed, and the jaw. You ask any body professional, whether they're a doctor, they're a chiropractor, a massage therapist, dentist, any professional that does anything remotely near the jaw. And most of the time, they are going to say that, oh my gosh, the jaw is probably like one of the most complicated structures in the body. It really, really is. And then sometimes in myofunctional therapy, you know, or we have stress patterns, we clench, grind the teeth. Mm-hmm. The jaw holds on to that. Our body, it remembers our traumas and our stress in many different parts, but the head, neck, shoulders tend to be the body parts that hold on and remember that the most. What would you say?
Yes.
Yeah. Tell me about.
So I just actually was reading something a couple days ago about how the jaw, right, and the alignment of the jaw can actually affect the alignment in the pelvis. So again, we're talking about how it's all connected, right? So from your jaw, if you have a misalignment in your jaw is not functioning properly, it can actually throw off the alignment of your pelvis. And you think about it from the jaw all the way down, then everything is going to be, like, use the word kittywampus. I don't know, it's an old school word. But as a chiropractor, I can adjust the jaw, right? Correct the alignment of the jaw. And then also the pelvis. So that's kind of in my realm and what I work on. But you work on as far as the muscles that control all of that stuff too, because I have a lot of patients that they come in to get their jaw adjusted. We adjust it, but it can't stay there because the muscles are so tight on one side or the other from clenching or teeth grinding and things like that.
Yeah. And I mean, and vice versa. I see clients that have been to many different professionals and like, oh, I can't stop clenching and grinding my teeth at night. And nobody is really, there's different therapies. There's PT and OT and myofunctional, of course. There's different therapies that affect or address the muscle dysfunction. But we're working specifically on function, and it's not just working on that jaw. We have to address the tongue, the facial muscles, because all of these muscles have jobs they need to do individually, but they all have to work together at the same time. So we don't want muscle systems overworking, like say your tongue doesn't swallow appropriately. And if that's the case, then all the rest of the muscles have to overwork, and they have to be recruited to help out do these jobs that they're not specifically intended to do. And real quickly on this, when we talk about the jaw, most people don't think about the way their teeth touch. So we call that occlusion, right? Where the way your teeth touch, it starts even there. If your bite is off, or you chew more heavily on one side and it's distorted the way your teeth line up, that is also a big contributor to misaligned jaws, and then overall body posture. So literally everything starts here and works its way down.
All right. So breathing actually is a great way to regulate or dysregulate your nervous system, depending on how you're actually breathing. So when you use a deep diaphragmatic breath. So what does that mean? That means when you breathe in, you're using your belly muscles, right? Or using your belly muscles versus just breathing up here, taking the big all the way down breath in. That actually helps to regulate your nervous system in a good way, right? So your parasympathetic nervous system is the side of your nervous system that helps you to be calm. It has to do with your digestion, so your rest and digest phase. Versus if you're really short, shallow breathing, that affects the nervous in a negative way, right? So in turn, that's going to put your body into fight or flight, because when you're, think about it, if you're, for example, as a cave person, we're being chased by a tiger, how do you think your breathing's going to be? Right? You're going to be breathing really fast. You're trying to get away from the tiger. So that's kind of what you go into, that fast breathing pattern. It kind of triggers your nervous system in a negative way to, hey, there's something bad going on. I need to direct everything towards getting away from the danger versus being calm and digestion and sleep and all of those good things. So we need to focus more on that positive breathing, those deep diaphragmatic breaths. And sometimes when you're feeling stressed, anxious, that's a good thing to do, right? Practice your breathing. So how chiropractic and myofunctional therapy work together. So as a chiropractor, I am going to optimize spinal alignment. Oh, did we lose our spot again?
It jumped ahead again. I'm not sure
Uh-oh.
why. Sorry
Hold
about
on.
that.
Back it up. There we go. Okay. There you go. The breathing.
Okay.
I was leading into you. Yes. So we want to focus on that positive, deep diaphragmatic breathing. And Becca, you have a specific breath technique that you're trained in.
Yeah, there are so many breathing techniques out there. So many. My particular modality specifically focuses on functional breathing, which is not quite the same as take a big breath in and blow out through your mouth. So when we're talking about the Buteyko breathing method is what it's called. That's a functional breathing. And most breathing pillars, there's three parts of breathing. There's mechanical, there's a biologic or a biochemical, and then there's cadence, right? So there's cadence breathing, which is like essentially how many breaths per minute are you taking? Most modalities don't really address the biochemical part. And I don't want to get too like sciencey here, but there's a huge connection too between how we breathe, and we're trying to optimize. There's three breathing gases, right? We have oxygen, carbon dioxide, and nitric oxide. And most of the time, the carbon dioxide part is kind of like, oh, that's our waste gas, blah, 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 you know. But we need to have a certain amount of that in order for oxygen distribution or delivery off of the red blood cells. So the breathing techniques that we focus on here involve, and this is the opposite of what most people hear, right? We want to take a breath in through the nose. We want to breathe out through the nose. And we do breath holding techniques, but we're always holding the breath on the exhale, not on the inhale. So most people think, take a big breath and hold it in, but we're kind of doing the opposite. We're blowing out gently and then holding the breath. And that's what allows, so that's going to work on vagus nerve, you know, fight or flight, rest and digest, like you were talking about. But also, yeah, the parasympathetic, we need that certain amount of CO2 in our bloodstream for all of those red blood cells to jump off, or excuse me, the oxygen to jump off the red blood cells and get to the areas of our brain, especially at night when we're trying to recover and get into those deep sleep stages. But then this also works for like breath. I put these little nose strips in here too, because we're seeing more and more athletes that are like using mouth tape, and they're using nasal strips because the connection of nasal breathing and overall recovery from sports, or actually improving performance because you have more oxygenation available to the muscles. It's all connected. It's all connected. That's the whole point of this. And I put a couple of these books in here too, because I can't tell you how many people have reached out because they read this book, Breath by James Nestor. It's just insane. And he talks about a couple of different breathing techniques, which is really cool.
I totally need the Sleep Work Kids one in the office. I'm going to have to get that one.
Yeah, there's a lot of good ones out there. So yeah, I just wanted to mention that part because there are so many breathing techniques and so many people are trained in different methods. So in the beginning, we talked a little bit about how posture starts essentially, you know, in your head, your neck, your mouth. So when we're talking about rest posture of the mouth, I showed the photo earlier with the tongue up in the roof of the mouth, supporting everything. And that's kind of what it looks like if you were to open your mouth and see what the tongue looks like against the roof of the mouth. Now, obviously, we're not going to walk around with our tongue up like that, but we want to be able to keep our tongue up in that position, but then keep our mouth closed. So, and at rest too, and this is another thing, when you're at rest, so your mouth is at rest, you're not talking, eating, or drinking, we should always focus on trying to have our teeth just a little bit apart and think about that, because if our teeth are touching all the time and we're starting to have those fight or flight moments or sensations of nervousness, what happens? We start to clench our teeth. So at rest, we want those teeth to always be apart. There's a swallowing component to that too, but that's for a different day. But we want to be able to breathe well through the nose. And then again, that's going to help to keep that jaw relaxed, centered in a good position, so we're not overstressing that jaw joint. This is a photo of, this is the lower jaw, and these are the lower teeth. So this is someone who's looking up towards the ceiling. And it's hard to tell in a lot of the anatomy pictures, but this isn't the best picture, but there's a little bone here, like underneath your chin. It's called the hyoid bone. And that is the only bone in the whole body that is not connected or, what's the word? That's your world. What's that word? It doesn't occlude with other bones. What's that?
Articulate. Doesn't articulate.
That's it.
Doesn't articulate with other bones. Yes, it's kind of just hangs out there.
Yeah, it hangs out there, but it's like this anchor point for all of these like muscle attachments. Mm-hmm. So when we're talking about the whole body connection, there's fascia, and we'll talk about that a little bit too. But I just wanted to throw this picture in because if you do certain movements with your tongue, you're going to see and feel things moving down here. So this literally, this oral facial structure, this tongue posture is basically like that trunk of support that goes up through the middle of your face and supports your skull and then all the way down.
And go ahead.
No, go ahead. What were you going to say?
The hyoid, I was going to add in, so I do craniosacral therapy, and there is, as part of that, a hyoid release. So the hyoid bone can actually become restricted. And it's kind of interesting because the training that I've had, they talk about how when you have a hyoid restriction, many times it's because you feel like you're not able to speak your voice. You're not able to speak your truth. And that comes into play with the emotional stuff, where maybe we'll touch on a little bit later. But yeah, so part of the craniosacral therapy that I do, there is a release for that hyoid to help that function better, which is going to help relax some of those muscles as well.
Wow, I didn't know that. That's really cool. So what would someone come to, what would they come for craniosacral or cranial release? Tell us more about that.
Yep. So for craniosacral therapy, I see quite a few infants, babies, kids. It helps with birth trauma, right? Because birth, even when it is 100% textbook and goes really smoothly, you think about it, you're in the womb for 9 months, this quiet, warm, wet place, and then all of a sudden you are out in a world. It's bright lights, it's loud noises, and that overstimulates the nervous system. So colic and acid reflux and things like that can all be related. And I do a lot of craniosacral therapy on my infants and babies. I have used it on adults though for headaches, migraines. I also have used it for people that have trouble with managing their anxiety and their stress. So it really helps to kind of balance and engage that calm side of the nervous system.
A little off topic here, but since we're talking about the cranial releases, the fascial release, do you see infants or even adults or older children who may have restriction in their tongue, and maybe they are going to have a tongue tie release? Because sometimes we'll refer.
Yep, absolutely.
Services before.
In fact, that was going to be when we get to the question and answer. I was going to ask about the oral ties and your experiences as far as not necessarily avoiding release, but leading up to release, because I know I do have a pediatric dentist that I work with, and a lot of times she'll refer to me to do body work before and after the release, and that, you know, kind of curious how you tie into that as well.
Perfect. All right. Preview of what's to come. All right. So that forward head posture that Dr. Nadine touched on earlier, and then I touched on the tongue part and the teeth and how they all fit together. So as we start to develop poor breathing habits, mouth breathing, the muscles are not working ideally, encourage that head to come forward. And when that head comes forward, we start to put tension on the jaw because it's pulling it out of its neutral. Yep. And then the like the SCM muscles, you talk about this part with the forward head, what it's doing with our spine.
Right. So, and this is like, I feel this is a bigger issue now than it used to be because of technology. Right? You think about it, what position are we in most of the day on our phone, on the computer, all of those things. And the muscles, those positions that we're in throughout the day, those muscles get tight and tense and stiff. And that actually can affect the alignment of the spine, right? And cause those, we talked about earlier, the subluxations in the spine, which affects everything else, the nervous system, and all those things.
Yeah, and then as we bring that head forward even more, we start to reduce our airway volume that's here. So lungs, lungs contract or compress. So yeah, here's just kind of a photo of that with like an ideal posture versus a not ideal posture. You know, the head, the ear should be relatively even with the shoulders. The jaw should be in a neutral position. In the photo, the incorrect photo on the right, we see the jaws kind of recruited backward, like towards the neck. And that will, you know, that starts to kink off some of that airway space. Diaphragm, look at the pelvic changes here. What do you see in this photo, Nadine?
Well, the first thing I notice on the one on the right is the accentuated arch in the upper back. She needs an adjustment. Yes, so that forward head posture, right, it's going to put a lot of tension in those muscles. It's going to pull on the spine. In the upper back, we're going to start to have accentuated rounding forward. We're supposed to have natural curves, right? We should have a nice curve in our neck, a little bit of forward posture in the upper back, and then a little bit of lower back curve similar to the neck. But as we start to slouch forward like that, like you said, everything starts to get restricted, right? The lungs, our breath, I guarantee you, in this poor posture is going to become more shallow and short. And what is that going to do? It's going to trigger the stress side of the nervous system.
Yeah, because then we start breathing more shallow, faster. That disrupts everything. That disrupts the whole nervous system, the breathing gas, you know, concentrations and all of that. Yep.
Yes. So this picture is pretty cool because it kind of shows how what I do and what Becca does works together, right? So the spine part, so the structure part, the bones and joints of the spine, the jaw, as far as structure, that's what I work on, right? Making sure those things are in the proper alignment. And then as far as the part that Becca works on is more the soft tissue, the muscular side of it, right? It all goes together. I can adjust people over and over and over, but if the muscles aren't in the proper position, especially starting with the tongue, right? Because I know coming up, I don't want to ruin it. We have a really cool picture of the tongue and how it's connected, like all the way down to your toes, right? That tissue. So it is all connected in there and affecting that posture.
And here's that picture.
There it is. That's like my favorite picture. I love that.
Yeah, I always bring this one up. I always include it in my conversations because this is literally how the tongue is connected to the rest of the body through the fascial system and through the hyoid bone. So if people aren't aware of what fascia is, it's this webby, interconnected, it connects all the individual cells and muscles and
It
organs.
basically holds you all together. Like
Yeah,
it's
like
like
the
your
glue.
sausage casing kind of.
Yeah.
Yeah.
And there's so many professionals. I don't work on the fascia itself. I'm not a fascial release person, but there are so many professionals that work on the fascia. And when I asked you earlier about the tongue, and we'll still get to that, but
Yes.
it's so interconnected. But people always drop their jaw. They open mouth, breathe for a second when I tell them that their tongue is connected to their feet, and they're like, "What? How do you breathe?"
So
And
this picture actually I bring up often with my craniosacral therapy people because so the cranial sacral system, right? It's cerebral spinal fluid, right? It's basically starts with your brain, right? Your brain is like this jellyfish, right? It circulates the fluid every 17 seconds. It's doing a cycle with stress, so chronic stress, muscle tension, tightness, emotional stuff, right? So past emotions, physical or emotional trauma, that's actually stored in, you just talked about the fascia. Those tight spots in the fascia can actually restrict the fluid flow. So that's where the craniosacral therapy comes in, works on releasing those restrictions so that everything can move, that fascia can be more free flowing, I guess you'd say.
All right. Well, we kind of talked about this quite a bit already, the breathing patterns, nasal. Yeah, so the nasal breathing is going to support the diaphragm as well, and the breathing, because even though we get less volume of air through our nose, that's the way our body is designed to breathe. We have things in our nose, hairs, bones, different structures that help prepare the air for the lungs. We have more efficient breathing for overall health, stress, sleep, everything when we actually utilize that nose. And that is also going to increase some of the pressure, and it allows our diaphragm to actually work more efficiently if we can have good nasal breathing. So we have to sometimes figure out why don't you have good nasal breathing? Is there an ENT issue? Is there a structure issue where maybe we need to see a dentist or an orthodontist? Is it a muscle issue? Is it a habit? Because sometimes mouth breathing is a habit. You got sick once and you breathe through your nose your mouth for 2 weeks, and then you just kind of continue to do that. So those are some of the things I would be checking for during my evaluation. But we have to make sure there's no problems with the nose. And if there's something preventing airflow through the nose, then I am not the first person you need to see. Like Dr. Nadine said, that mouth breathing, that's going to allow more for upper chest breathing, which is more inefficient. We want to be able to breathe deep all the way into the whole bottom parts of our lungs, which often don't get as much action as they should. We don't breathe all the way through our lungs. And the diaphragm, and most people don't know this, and this is more your side of it, but the diaphragm is a huge, huge muscle support structure for the spine.
Absolutely. Yes. And the diaphragm can have restrictions as well, right? Tension can be stored in there. In fact, my newborns and my infants, I do diaphragmatic release because a lot of that tension from I'm going to call it birth trauma, which is what it is, that can be stored in the diaphragm, and it causes that tightness in there too.
So what would that look like in an infant or a baby?
Diaphragmatic release or the tension?
Like, what would you notice as far as symptoms, or can you tell by the way they breathe or the things that mom or dad
Yes.
might tell you?
Yes. So the short, fast, shallow breathing, like a lot of colic symptoms can be related to that tension, not only along the spine, but also into the diaphragm because, right, it's all connected. So that, yeah, those are some of the symptoms of frequent crying or a lot of arching backwards or a lot of gassiness. All that can be related to some of that tension in the belly.
Good. All right. So the tongue and the pelvic floor. We didn't necessarily talk about the pelvic floor a lot, but we've made all these connections already about how it's all connected through that fascial line. But we know that if some professionals, it depends on your training. Some professionals think or feel that dysfunction starts in the head and neck area, and some things it starts in the pelvis and the hips. And I don't think one way is wrong. It's just how are you trained, and like how are you looking at the chain of the body? But regardless of that, it's a bi-directional relationship. So if we have dysfunction or misalignment in our spine, our hips, pelvic floor, or the jaw, whichever way you're looking at it, it's going to continue to have that impact down the chain. So when I showed the photo earlier of the fascia, when I'm talking to people, I like to describe that fascia as like a chain, like chain links. And from my world, because I start here, if that first chain is kind of twisted and kinked up, then that's where it starts to have tension, that starts to go down through the rest of the body. But then you add things like accidents, physical trauma, emotional trauma, all of those things too are going to contribute to this posture and this dysfunction. So we talk very generally about relaxing the tongue to relax the pelvis, chronic tension in the jaw, because the jaw connects to so many things as well, and we don't really think about it. But simply having that tongue rest posture up on the roof of the mouth and starting to have stability here will make its way through the system. Go ahead, Nadine.
Okay, so why does posture and breathing, why does that matter to moms? So I do see a lot of pregnant mamas, and you think about it, as baby is growing, as your belly is expanding, what happens to the lower back, right? It starts to arch more. So what happens then to the neck and the upper is we have to counterbalance. So we have to that head and neck come forward more, right? So not only do you have baby up under your ribs compressing some of the lung capacity, but then you also have that more forward posture because you're trying to balance for the belly weight and the lower back being more arched. So pelvic floor is under pressure, definitely. And the diaphragm is going to change as far as how it moves and how well it moves because of baby taking up some of that space.
Yeah, that's a big one. And we already don't sleep good when we're pregnant, right? Like that's just a given. So if we can have as much stability during this time of pregnancy, we'll have better sleep, better breathing, and yeah. So it again, all works together. I was going to put this in like arrows, like this, then this, then this, then this, but basically, when we're looking at things from the mouth and the oral posture side of things, the things to be aware of are, and these are the chain of events that are going to start to affect your posture. First is that chronic mouth breathing. Mouth is open, jaw falls backwards a little bit, and then we start to get that forward head, and it starts to put tension on our jaw and our neck and our shoulders, and then it starts to kind of compress the diaphragm, and then men as well, but more so women, more so of that pelvic dysfunction. And then generally, we start to see really big impacts in sleep quality. So this is just kind of a summary of the chain of events that can start from the mouth down. So the easiest thing to do at home, and I say easy in quotes because that's oftentimes why people find someone like me, because it sounds like it should be easy to just keep your tongue up inside your mouth. And it's often much more challenging than people expect. Are there ties? How much tension is there? There's the fascia connection, all the things. And so sometimes we have to actually teach you how to do that. And that sounds crazy, right? 'Cause it should be so simple. But something that you can do at home is just start to get your tongue up into the roof of the mouth. Even if you start by doing tongue clicks. And then over time, you start to keep that tongue up. And then try to keep it up with your lips together and start having that mouth posture. Sometimes people will put like a popsicle stick or something, or an old expired credit card or something just thin between their lips as a way to have some proprioception of, hey, my lips are supposed to go together. you're holding on to something. So if it moves or falls, you're going to notice it. So as long as you can breathe well through your nose, you should be able to do these things. It might take a little bit of work and practice, but those are some things that people can start doing at home. And then again, just really practicing, depending on what kind of breathing techniques you like to do for yourself. Take nice big breaths where you're just trying to expand your whole lung cage. I'm going to ask you to try to do that with your nose only, but it's okay. You do whatever technique works for you. And then, we are a team. There's so many professionals out there that work on the body in different ways. So when you have the opportunity for other professional people to work together and say, hey, Dr. Nadine, I've got this case. Can you give me some insight from your point of view? And then I can connect them to you, because when we have that team of people, that's where we can really get the best results for all of our patients and clients, regardless of their age.
Absolutely. Yes. So how chiropractic and myofunctional therapy are whole body support. So I am going to work on optimizing spine, right? So the alignment of the spine, removing those subluxations, optimizing the nervous system function, right? So basically we talked about the phone and the charger. So we're going to make sure that that phone charger is carrying those signals from the brain like it's supposed to, so that everything in the body is getting full power. Becca is going to address the oral posture, the tongue positioning, the breathing pathways, all of those things. And they all work together, right? Starting, like we talked about right from the beginning, starting at the top, and it goes all the way down. So myofunctional therapy and chiropractic are ideal for pretty much everybody. I mean, kids, pregnant moms, pretty much whole family wellness. I don't know about your guys' family, but at my house, there is a lot of snoring going on at night. I sleep with earplugs. So Becca, maybe sending my husband over to see you at some point if I can get him to go. But yeah, it is the snoring and like all that, those kind of things. Like we want our bodies to be able to function at their best. And like you said, having a team of people. So the myofunctional therapy, the chiropractic, we talked a little bit about pelvic floor and how that all fits together as well. So having that team of people to help your family function their best.
All right. Do you want to, do we want to pause here and maybe ask
Some questions?
Yeah. All right. I don't want to put anyone on the spot, but I wonder if there's anyone watching this that may have some more pelvic floor knowledge that maybe we do. And if they want to chime in, that'd be amazing, but no pressure, no pressure.
No pressure.
You guys are awesome. This presentation has been so great so far. I just love the connection between, well, everything in the body, really, when it comes down to it. And the amount of times that somebody comes in with pelvic floor symptoms, and they're seeking pelvic floor therapy, but it ends up like that we need a team of people on this because you got also some things going on. Like I'll end up asking up the chain and they're like, oh, well, why are you asking me about that? I didn't think it was related. But, sometimes things don't completely resolve down there until you resolve up the chain. So this has been absolutely great. I love nerding out about this stuff and how the body is connected, and especially when it comes to treating moms, because it just the changes that happens throughout pregnancy and then postpartum when you're trying to care for a baby and your lifestyle's completely changing, and how to get your body back to its optimal functioning again. So I definitely appreciate the knowledge, you guys.
I wish I knew. I wish, and we all say that. I wish I knew. I wish I knew. I wish I knew way back when, right? I truly, honestly mean that when I say it, because my son is 9, and I knew about myofunctional therapy then, but it wasn't really. I never heard of pelvic floor therapy when I was pregnant with him 9 years ago. And at the time, it was suggested to see some to do some chiropractic work. But I had and to get a little personal, but I had a really challenging pregnancy. A lot of pain, like tons of pelvic pain, lower back pain. It literally debilitated me. And I had no idea that this stuff existed. then like I do now. So if I knew that, I would have gone to see all of the people, the pelvic floor, the massage, the chiropractic, all of the people, just to try to help support. And then that was, of course, a very stressful pregnancy, stress on my baby and stress on me afterwards. So whenever, even though I don't address pelvic floor specifically, and I'm not a chiropractor, when I hear of these things, again, I want to make sure we have that team in place so that, okay, you live here. I know people. Let's try to connect you with those people so that they can help ease your symptoms. And even if you don't have symptoms, just to promote that overall health for you and your baby. But pregnancy, yeah, it's so much harder, I think, than a lot of people talk about. So I'm glad that all of you guys exist that also work on that part of things.
So a question, Becca, as far as we talked a little bit before about the ties, oral ties, can you kind of elaborate a little bit on that as far as from what you do, how you can help with that versus having a revision?
Yeah, so I work with kiddos that are 3-4 years old and older. I don't work with babies. But even with my kids and my adults, there's some myofunctional therapists feel like if you don't agree to essentially have a tongue tie release, they may not work with you. And I don't think, from my perspective, I don't think that's really fair, because when I'm assessing someone for a release, there's different kinds of tongue ties. I don't want to get too into it, but we're all thinking about the tongue tie right on the tip of the tongue. Mm-hmm. And that's the one where if your pediatrician or ENT or dentist who's not airway trained, if they don't see that little tie right on the tip of the tongue, they're going to say you don't have a tie. But what they're not looking or considering into is the posterior part, or what's behind that string that we can physically see. And that's where the fascia comes into play. And that's where that string that we see extends more submucosally into the tongue muscles under here, and then into the floor of the mouth. And then that's where that fascial chain starts, right? So I'm assessing for something called a posterior tie. Mm-hmm. And that is not just about what the tie looks like. It's highly connected to function. How do you sleep? How do you breathe? Are you grinding your teeth? Are you still wetting the bed? Are you snoring? Like, what are your symptoms? And we're looking at how all of those muscles are working. So with that said, then I would say probably 80% or more of my clients come and they say, I don't want to have a release unless it's the only option. And I 100% agree with that, because we have so many muscles in our mouth. Our tongue alone is like 8 pairs, so 16 muscles. And that's not including the 43-ish that are in our face and then the neck, and it goes down. So we're talking about a lot of muscles. And those are muscles, if there's been dysfunction for most of your life, you have a whole muscular system that's never been developed. Mm-hmm. So I want to see first, before we go and do a tie, unless it's severe, of course, or they've been referred by a doctor who's like, yep, you need a tie. That's a different conversation. But we want to address the function first. And I know myself, I got my muscles working, and it allowed me to be able to come off my CPAP machine after 14 years. I was diagnosed with that at age 28. And we're seeing those diagnoses of sleep apnea or sleep disordered breathing, upper airway resistance in younger and younger people. It's not just that overweight person anymore that's being diagnosed with sleep apnea. So we have to develop those muscles. And if we start developing those muscles and we still aren't improving symptoms and we still can't maintain that position of the tongue, then I kind of reassess, how's that restriction now? How's that tie now? But that's my take on it, is if you've got a problem with your leg, your knee, okay, before a doctor is going to do a procedure on you, they're going to send you to a physical therapist, right? You have to work the muscles and strengthen the structure. Usually it's not the bone that's the problem. It's all the muscle around it that's just needs some help to support the structure. So structure and function, hand in hand.
Mhm.
So that's where I stand where it comes with tongue tie release. We don't all need one. Do we all have some degree of restriction? Of course. Do we all have some degree of restriction in our back and shoulders too? Of course. It doesn't mean we need a procedure. So just like you would go to PT first for your bad hip or a bad knee or a bad shoulder, I want to see how you can develop your muscles first before we say, you got to go have a tongue tie release. But we're looking for that deeper part. Yeah, question. Go ahead, Erica.
I was just curious, like following up on that, because I completely agree. I actually hadn't heard about myofunctional therapy until I met with Dr. Brian at Howard Cairo, and he was like, you actually have some like mouth restrictions, and then maybe you want to consider this before going on to like any sort of revision stuff, and that just makes sense to me as a PT, right? But do you find that people will come to you after having that intervention or after having a revision, or even the younger kids, and that their problems almost become worse because they haven't learned how to properly use that new mobility now and things like that?
Absolutely. You cut out a little bit, so I think I got the gist of your question, but no, that's okay. Absolutely. I can't even tell you how many times I can count in a week that someone contacts us and says, so-and-so, my baby or my child or myself had a tongue tie release and it helped for a month or two, and now I feel like things are worse. So there is nothing wrong with dentists, ENTs, different professionals are trained to do a release, but it's just what part of that release are they addressing? If we can move that front part of the tongue well, then doing what sometimes they snip or clip, right? They will snip the string. Now, this is not applying to babies because that's a whole different situation with babies and a different set of issues. But you can just go and have that tie snipped or use a laser and just basically kind of cut it in half, right? But that's only going to affect the front part of the tongue, the anterior part of the tongue. So if the part of the front of the tongue is fine, and you can move that just fine, having that simple frenectomy is not going to improve your function. So from the airway perspective and the myofunctional, that's where we're looking at what's right behind the string. We can't physically see it, of course, but we can see it in how the muscles move. But oftentimes people come and they say, yep, my 7-year-old had a tongue tie release when they were 3. We still have all these issues. And if the work isn't done, like you were asking about the muscles, because just having the release is not going to solve the problems. And oftentimes that's what the expectation is. All right, I have a tight tongue. I'm going to go get it clipped or snipped or revised or however you want to put it. And it's going to fix all my problems. And it doesn't, because you still didn't address the muscular system. So that's why, certain providers are trained to do that deeper release that's going to affect that fascial part. And they will not do your release unless you've done myofunctional therapy and your muscles are ready. Because when you have a tone in those muscles, that's what allows that fascia to kind of release itself out of the tissue or the muscles. They literally, do the release and they literally scoop out the fascia. They literally scoop it out. It's incredible. I had this done myself, but I didn't do it right away. I waited over 3 years to do that. And the reason I did it was because I just couldn't get past tension I had in the front of my neck, but it wasn't impacting my function. I was sleeping way better. My muscles were stronger. I was chewing and swallowing better, but that's why I ultimately did that. But yeah, the muscles have to be ready. And if they're not, and you just go get that release because you're at your dentist office anyway, and they're going to clip it for you, you're likely going to have more scar tissue at the back end as well, which may restrict function even more because now you're not stretching afterwards and letting those muscles adjust. And then to improve the symptoms, you have to do the therapy if you want to get the best outcome. Sorry, that was kind of rambly, but did that answer the question?
That's why a lot of times, I would say 99.9% of the time, I will assess all my newborns that come in, babies, kids, for the ties. But before I refer them, we do the cranial sacral, we do the body work, we do the muscle work. And a lot of times I will refer them for the release, and the dentist that I refer to will send them right back and say that within 3 days, they need to have more body work, because like you're talking about, Becca, those muscles have to be retrained to do what they're supposed to do.
Yeah. And babies are so tough because you can't really do myofunctional therapy with a baby, but that's where like feeding and lactation comes into the picture. So that's where we have another group of team members that are going to help that baby. There's a lot of specialists with infants and babies, both structurally and like soft tissue and function. So yeah. But yeah, the babies, you want to do those stretches afterwards. And sometimes those parents, they find a professional that can help initiate some of those stretches, because it's not the easiest or most comfy thing to do.
Yes. Yeah.
Yeah. But, and it's impossible to know when an infant procedure is happening. It's impossible to know like how deep the release is. With babies, there's more of an immediate need, right? They need to feed. They're not suckling well. They need to be able to feed. So there's more of a moment of desperation that, okay, something has to be done. Mom is in pain. It's just not working functionally. So depending on how deep that release is initially, sometimes when babies get a little bit older, depending on how their symptoms progress as they grow, sometimes there's, a benefit to having a repeat procedure down the road. Is it always necessary? Absolutely not. But I do like to tell parents too that sometimes when babies have a release, just keep it in the back of your head as they're growing. If they start grinding their teeth or they're wetting their bed beyond potty training years, or the mouth is open, there's still something else that's missing. So just keep it in the back of your mind if they need more support with other professionals as they get older and they've already had an infant release.
Absolutely. I love that.
Yeah.
If we have any other questions.
All right.
Cool. I guess not.
All right. So do you still see your slide, or do you want me to mention or move on to the next one here?
No, I think we move on to the next one, because we talked about how we're connected, what we do. Yes. So if anybody watching this, or if you're watching the replay, if you're ready to take the next step, so scheduling a chiropractic evaluation with myself to assess your posture, nervous system, all of that. And then also connecting with Becca for Airway and the oral support of it. And then also talking to either of us, feel free to message us or any of that as far as how we can work together to help you, your child, or your family to function better. So you want to make those changes now. But if you're an adult and you're having the snoring issues and things like that, hey, it's never too late to get started and start feeling better. So I am doing, for anybody watching this, you get scan this QR code and get scheduled, and you get $40 off your initial visit. So your initial visit with me is going to include going over any health history that you have, doing an in-depth examination, and also includes your adjustment for that day. If I don't find a reason, if I don't find any reason that we shouldn't start treatment, you can get adjusted that first visit as well, and kind of get the path started.
And likewise, I'm offering a discounted offer on a full functional oral facial functional evaluation. And this is important, Nadine, you just said it. It's never too late. It's never too late. Sometimes, parents call and they say, my kid is 10. Is it too late for them? No. Because a lot of times they feel like that myofunctional therapy is just for kids, and it absolutely is not. My oldest patient was in their 80s. And I have an almost 70-year-old right now who's looking to get her tongue tie released. So there is never too late to address your symptoms. And yeah, and trying to just start young. If we can start anything young, that's just going to be helpful in guiding, you know, good posture, good breathing, just everything. And then you can build on that. So it's never too late. So same thing, if you want to talk more, give us a call. You can email or message Dr. Nadine or I. We are always happy to chat with people, even on the weekends. Like you'll find me texting and emailing people.
Absolutely.
Because we're just really here to support everybody. And even if we're not the right person for you, we have people that we can connect you with to get you started on your health journey.
Get your team started.
Yep. All right. And that's what we got for today. Is there any other comments or questions?
Thank you, Erica, too, for chiming in. That was awesome.
No problem at all. Honestly, this was really great, guys. You both are incredible professionals. And Dr. Nadine, I've had the pleasure of sitting down talking with you one-on-one. Becca, I know we've like met in passing, but we should sit down and chat a little bit more and dive into like more about what your services are and everything. So
Absolutely.
Very much like-minded people and love having you guys to refer to. So thank you so much for this presentation. I appreciate it.
Yeah, thank you as well. And we will be in touch. And anyone who signed up for today and couldn't make it live, we will have the replay for you. We'll try to get that sent out this afternoon. So keep an eye out for that and reach out whenever you have questions.
Sounds good.
All right. Everyone have a good day.
Yeah, thank you.
Bye-bye.